I want us to compare these concrete examples of two-faced scheming and profiteering with the central arguments that we are going to get this morning. The central argument is basically from pharma: the fault is always somebody else's. The health plans are at fault. The pharmaceutical benefit managers are at fault. Regulators are at fault. What we know for certain is the history that pharma CEOs always say somebody else is at fault.
The U.S. has some of the highest prices in the world. That's not universally true. The government has some relatively low prices in comparison. But I think the fundamental issue is this. Our system is built around a variety of pricing around the world, but that overall system supports our R&D model. If a market at the size of the United States were to collapse to the lower end of that pricing model, then I can just tell you AbbVie would not be able to invest the level of R&D that it invests today.
And what really concerns me is when we don't treat these issues as a systemic issue and the public thinks that they have to have outrageous solutions to the problem where in the future we won't get these drugs. So I would hope that we could talk about these things systemically and try to come up with the kinds of solutions that will in fact make patients have access to medicines today while allowing tomorrow's breakthroughs to happen.
The people you pay to lobby us here in Congress come out and say, nope, we can't do anything like that. That might look like price control. We are not interested in taking any look at this monopoly problem in your industry. I shouldn't even say it's in your industry, because I think a lot of these people are raiders into your industry who aren't really part of your industry. They don't really develop drugs. I see a lot of head nodding here. So help us solve at least that problem. You know, there are lots of other problems that we're going to have to look through with your pricing. Help us solve at least that problem. Turn off your lawyers and your lobbyists as antagonists when we try to solve that problem.
We will.
In fact, switch them on and say, let's figure out how we deal with these modern monopolists who aren't even really in the pharmaceutical industry.
I couldn't agree more. These people are at worst, at best, tone deaf, and at worst, abusive.